All of the students are going out into rural areas in North Florida. We've got 4 different locations, and it's an opportunity for those who've never experienced a rural area to get out and meet the people, to see what the healthcare is about, and see what needs that they have.
So we'll be talking to the students about what resources are available within our community, and I hope that they walk away knowing that it's not a bad thing to practice medicine in a rural practice. There's lots of opportunities for them as clinicians, but also lots of ways that they can help their patients and help provide them the medical care that they can't get in other places.
25% of our class comes from the Panhandle area, but that means 75% of our class comes from other parts of Florida. One of the missions of the College of Medicine is to produce doctors for rural areas, and so we really want students to get an understanding of what that actually means. Many of them are from big cities: Orlando, Miami, Fort Lauderdale, Jacksonville, and they have hospitals just down the street. They come out here and they realize that all they have is a doctor's office and a public health service and a dental clinic, and the specialists are miles and miles and miles away. So this really gives them an opportunity to see why we hope that some of them are going to live the mission.
When they were walking through the hospital today, I was behind a couple of students, and they were saying, "My God, this is a beautiful facility. It is so clean, it is so nice." But they noticed that it seems so empty. And part of the issue for RuLE, it's kind of a teaching moment, an education moment, is that low occupancy is an issue for RuLE. You've got small numbers. You don't have 1 million sick people occupying beds. So now you have these small hospitals like at Liberty Calhoun, like at Madison Memorial.
Having a tour around the place, it just gave me a great view of what it would be like working in a rural setting. Originally, I had some apprehensions what I thought about working in a rural setting would be like.
Medicine is everywhere. When you go to medical school, you gain all this knowledge and you start believing that you have to be in a huge city or a tertiary care type setting to provide good health care, and that's not the case. And hopefully today a lot of these students will see that and understand that it's not so bad out here in the small town.
I'm just thankful. I'm glad that this, FSU College of Medicine made this an opportunity for us. It's really cool because I always thought, I might want to go back to my hometown because I'm from Defuniak Springs. That's where all of my family lives. But being here today, I'm like, this is so cool, and it's awesome being able to learn from other communities like my own.
The students note that they feel so weird, that they feel like they're being recruited 7 years too soon, But they see these young students, they know that this is hopefully only one opportunity that they will have to make a first impression. But this is the first impression, and we hope that it counts.
If you aren't raised in a place like this, you don't know what opportunities are available. And so if they can see that they can practice the type of medicine they want to in a very rural place, it helps them keep their options open while they're medical students and residents.
Being one person that's serving a majority of the community, I see it as an opportunity to make a huge difference and make a huge contribution to a place in need, and I see it as a great opportunity to serve others.
Florida Blue has been a sponsor of these trips since day one because we needed a way to underwrite the cost of the buses and the meals and any of those things. Florida Blue is one of the only insurers who is present in all 67 Florida counties. When you talk about the 30 rural counties, you're talking about poor, you're talking about uninsured. So the fact that they're there speaks to their commitment. I think we want to express our gratitude to the Dean for supporting this project, for seeing it as being an important addition. I want to thank the Curriculum Committee a few years ago for recognizing this as more than just a piece of orientation, but also bringing it into the curriculum as part of the overall learning experience. And I really want to thank all of the co-planners and the faculty and the staff who have participated themselves in this visit, taking a day out of their lives to ride the buses with the students and expand what they know about rural Florida and rural Floridians.